doctor has requested to do a cardiac and respiratory assessment on you. I need you to, if you could, just go ahead and verify your name and date of birth for me.
Hunter Hadaway, 11797.
Okay, good deal. Now I'm gonna wash my hands, and I'm gonna close the curtain to give you some privacy.
Okay.
And then we're gonna get started on your cardiac assessment first, okay? So to start off, I'm just gonna listen. I'm gonna feel for your pulses right here, and I'm gonna check for any edema in your upper extremities, your arms, okay?
Okay.
All right. I'm gonna check for your capillary refill right here. Pulse right here. Okay, and I'm gonna check this side as well. Do the same thing. I'm gonna check that refill one more time. And I'm gonna check this pulse as well. Okay, so all four of your pulses that I pushed on, I would rate them about a 2, which just means they're normal, so that's nothing to worry about. And I'm gonna go ahead and listen to your heart.
Okay.
Okay. So I'm just listening at your aortic valve. And I'm gonna move over to your pulmonic valve. Move down to your Erb's point. Tricuspid valve. And I'm gonna get right up under here and listen at your mitral valve. Okay, I'm gonna do the same thing, but this time I'm gonna listen for murmurs, okay?
Okay.
And again, I'm gonna go right under here. Okay. And just like I checked your upper extremities, your arms, I'm gonna check your legs as well for any kind of edema, your capillary refill, and also I'm gonna check those pulses right there.
Okay. You want me to have my shoes off?
I can take them off for you, that's okay. All right, so we have you have a pulse right here in your foot. You got one right here behind your ankle.
I'm ticklish.
You got one right here behind the back of your knee. We're going to check for capillary refill on your toes. Sorry, I know that can be a little ticklish. Okay, and I'm going to check this one right here. And one more time behind your ankle. I'm going to go up and check this leg. And feel behind this. Okay, so all the pulses I checked on your lower extremities also feel, I would rate them as a 2 as well, so again, just normal. You also have pulses right here we can check, and then right here in your carotid.
Okay.
Now I do need to check your jugular vein, so if I can just get you to kind of tilt your head and turn. Okay, and the other side for me. All right, that looks good. So I'm gonna cover you back up, and then we'll jump into your respiratory assessment.
Okay.
Okay, so if I can have you sit up just a little bit for me. Okay.
Out.
All right, take a deep breath for me. Okay, another one. I'm gonna move down to your lower lobe. Take a deep breath. This is your right middle lobe. Deep breath. I'm gonna listen on the side for your right lower lobe. And then the side again for your left lobe, your left lower lobe. Okay. I'm gonna swing your hair out the way and I'm gonna check the back, okay? So deep breath for me. One more. Okay. Last one. Okay, so everything sounds clear. I don't hear anything in them, so that's always a good sign.
Okay.
Now, are you having any chest pain or any trouble breathing or anything?
No.
Okay. If you do feel like you're getting some trouble breathing, I want you to practice taking a deep breath. So what you're going to do is take a deep breath, hold it for as long as you can, and then blow it out. Okay, and I want you to do that 10 times an hour. So
Okay.
once every 10 minutes, you should be fine. Or, yeah, well, just make sure you do it 10 times an hour.
Okay.
If you also feel like, you know, you're still not getting it, we can give you an incentive barometer, and
Okay.
we'll set a goal for you. And so that'll help again. We'll take a deep breath, and it'll make us, you know, help us reach that goal, and then we'll blow out into it.
Okay.
I do need you, we also want to make sure we don't get any mucus buildup. So I want you to turn your head and cough real hard for me. Go ahead and show me that. Okay. So it don't look like you have any kind of sputum or anything built up, which is good because that means
Okay.
there's nothing in your lungs.
Okay.
So if you just practice that breathing for me, we should be okay.
Okay.
All right. So I am done checking you out as far as your cardiac and respiratory assessment. If you want to lay back, get comfy,
Okay.
we'll put your bed rail up.
Okay.
And then here's your call button. So you call me if you need me.
Okay.
Here's your phone.
Okay.
And here's your remote. So
Okay.
everything's right there in range. If you do need to get up for whatever reason, let me know first. I'll help you get up. Just push that call button and I'll be right in, okay?
Okay.
All right. You have a good day.
Bye.